Hello, and welcome. Today, we're diving into the world of cardiology to understand a common yet complex heart condition, myxomatous valve disease. We'll explore what it is, what causes it, how it affects the heart, and what can be done to manage it. Let's embark on this journey to better understand myxomatous valve disease. So, what exactly causes myxomatous valve disease? The underlying cause involves the degeneration of the connective tissue within the heart valves. This degeneration leads to a weakening and thickening of the valve leaflets. While the precise triggers aren't always known, genetic factors play a significant role, often with family history being a key indicator. Certain connective tissue disorders like Marfan syndrome and Ehlers-Danlos syndrome can also increase the risk. In some cases, the disease can be idiopathic, meaning it arises spontaneously without any identifiable cause. Now, let's delve into the pathophysiology, or how myxomatous valve disease actually impacts the heart. As the valve leaflets become thickened and elongated due to the myxomatous degeneration, they may not close properly. This incomplete closure allows blood to leak backwards through the valve, a condition known as valve regurgitation. The heart has to work harder to compensate for this leakage, leading to enlargement of the heart chambers and potentially heart failure over time. The affected valves are also prone to prolapse, meaning they bulge backwards into the atrium during heartbeats, further contributing to regurgitation. Regarding epidemiology, myxomatous valve disease is a fairly common condition, particularly affecting the mitral valve. It's estimated that a significant percentage of the population, particularly older adults, may have some degree of mitral valve prolapse or regurgitation related to myxomatous changes. While it can occur at any age, it's more frequently diagnosed in middle-aged to older individuals. It affects both men and women, but some forms may be more prevalent in one sex over the other depending on the specific valve involved. The signs and symptoms of myxomatous valve disease can vary widely depending on the severity of valve leakage. Some individuals may experience no symptoms at all, while others may develop noticeable signs. Common symptoms include fatigue, shortness of breath, especially during exertion, palpitations or a fluttering sensation in the chest, dizziness or lightheadedness, and chest pain. In more advanced cases, symptoms of heart failure, such as swelling in the ankles and feet, may appear. Diagnosis of myxomatous valve disease typically involves a comprehensive evaluation. A doctor will start with a physical exam, listening to the heart with a stethoscope to detect any abnormal heart murmurs. An echocardiogram, which uses sound waves to create an image of the heart, is crucial for visualizing the valves and assessing the severity of any regurgitation or prolapse. Other tests, such as an electrocardiogram or ECG, and chest X-rays, may be used to evaluate the heart's electrical activity and size. While myxomatous valve disease doesn't have strict types, in the same way as some other conditions, it's important to recognize that it can affect different valves in the heart. Most commonly, it involves the mitral valve, leading to mitral valve prolapse and regurgitation. However, the tricuspid and aortic valves can also be affected. The specific valve involved and the severity of the valve dysfunction will dictate the approach to treatment. The treatment and management of myxomatous valve disease depend on the severity of the symptoms and the degree of valve dysfunction. For mild cases with minimal or no symptoms, regular monitoring with echocardiograms may be all that's needed. When symptoms are present or the valve regurgitation is significant, medications can help manage symptoms like high blood pressure or heart failure. In severe cases, valve repair or replacement surgery may be necessary. Valve repair is generally preferred over replacement, but the best option depends on the specific condition of the valve. Surgical options include minimally invasive techniques to reduce the risk of complications. Unfortunately, there are no specific ways to directly prevent myxomatous valve disease, especially when it's genetically determined. However, maintaining a healthy lifestyle, including regular exercise, a balanced diet, and avoiding smoking, can help minimize the risk of developing related complications like heart failure. Individuals with known connective tissue disorders should work closely with their healthcare providers to manage their condition and monitor for any cardiac involvement. The prognosis for individuals with myxomatous valve disease is generally good, especially with regular monitoring and appropriate treatment. Many people with mild cases can live normal, active lives. However, in more severe cases, the condition can progress to heart failure or other complications, requiring more aggressive interventions. Ongoing research is exploring new ways to repair heart valves using minimally invasive techniques and developing novel therapies to address the underlying mechanisms of valve degeneration. Gene therapies may one day offer possibilities for directly addressing the genetic causes of myxomatous valve disease. That concludes our exploration of myxomatous valve disease. We hope you found this informative. Remember to consult with your healthcare provider for any specific concerns or questions you may have.